Welcome to Health Stealth Radio, where we move away from the mundane to gather insights from the shadows of enterprise and patient cybersecurity. Yes, we surely believe that traditional themes like endpoint software and zero trust are critical, but given massive advances in AI, remote and wearable device hacking, and data hostage negotiators, there's a much darker side to cybersecurity, and not everyone is quite willing to talk about it in public. Health Stealth Radio will thrive on these topics and encourage fireside spats to debate them. Here's your host, Frank Cutitta.
Welcome you to Health Stealth Radio today. Denise Anderson has been, actually, as we were just talking about, she was my first guest on Health Stealth Radio, and that was 2 years ago. I can't believe it happened, and her first episode was on hacktivism. So as many things stay the same, some don't. And so we're in the midst of that right now. So just like all of the most important news programs, we'd like to bring Denise back out as the subject matter expert on this. A couple things that points I want to talk about is the obvious of what's happening and what might be making this different. Number two, Denise just got back from Asia, so I'm always interested in what makes it a little bit different here, or if anything at all. I know the Asians are getting a lot more of their oil from the Middle East than we might be, so that might be even more pertinent to them. Thirdly, on your website, you referred to what effect this is having on people, and especially CISOs, I'm sure. And I've been doing a lot of work since we talked last time on CISO burnout. So I'm sure this is not something that's helping them sleep at night. So without further ado, Denise, really great to have you and Health-ISAC back again.
Great. Thanks, Frank. I'm so excited to be back on it. I can't believe it's been 2 years. So yeah, I was kind of shocked when you said that. I was like, wow.
We're still here.
Time flies.
You've come out with a few documents and advisories on what's happened with Iran and most notably the Stryker event that happened and how these things are all linked together. How is this? Is this different than what we've experienced before with change and other things, or what? How do you see this other than what we see in the news? Is Frank, this is obviously different because it's incessant bombing. It's going on and on, no end in sight. But just don't want to stay.
Yeah, I think there's a couple things. I mean, one is obviously we're in conflict with Iran right now, and so that's definitely a thing. Two, we don't have CISA. CISA is not at the table on any of the calls or anything that we've been doing. So that's another reason we've been really forward in putting out advisories and doing podcasts, because the ISACs, I was just in a meeting where I said private sector is holding the flag on this one, where, our government partners just aren't at the table, not necessarily because they don't want to, but they can't. Mm-hmm. Their hands are tied. So that's, a totally different situation. And then third, it's hacktivism. So yeah, that's one of Iran's personas and one of their tactics. But I think in the past, it's been more about defacing websites and doing DDoS, distributed denial of service attacks, which we saw when I was in the finance sector back in 2012, 2013. This one was Wiper. So they erased data off of devices. And so that was a little bit different. It's, a completely destructive attack. Mm-hmm. I don't know that there's many indicators to share either. So that's been a little different this time. So that, there are some similarities in that this is, things that we deal with all the time, but there are a lot of differences as well.
I think the last time we spoke, people in my position get all, not excited in a good way, get all excited about what this could possibly mean, especially as it relates to healthcare devices. And then you start getting Stryker and you say, well, this is really going back to what we talked about 2 years ago during the Gaza and the Ukraine thing. And you were one of the only people that said, to be frank, settle down. This is not, they're not going to be going into all the medical devices, but they could. It hasn't evolved that far yet. Do you think because of what's happening, and I lose my credentials if I at least say the word agentic AI once in a discussion, do you think because of the nature of this rapid technology change that the scenario and the attack sector has changed?
So I don't Yeah, AI is all the buzz, and you can't go into a room where people aren't putting those two letters together. I kind of look at it as a little bit of a fad in some ways.
Right.
I don't know that the reality as far as agentic AI and, certainly we're seeing artificial intelligence being used by threat actors.
Yeah.
And it's being used by threat defenders, so, this is the landscape will go that direction. I don't know that we're completely there yet. I don't know that this attack has anything to do with AI. I believe it has to do, we talked about this 2 years ago, the fact that there's some ties to Israel. And so that could definitely be part of the strategy on the part of the hacktivist group. So, and they certainly mentioned that in their communications that they put out there. I mean, we also have to take some of what they say as with a grain of salt, because that's another tactic that they use. A lot of disinformation and
Who's that? Who's that? They?
The hacktivists.
Okay.
Okay. That's a tactic. A lot of times they'll take claim for stuff that they didn't happen, or that somebody else did, or whatever the case may be. So you always have to go into it with your eyes wide open and kind of, take things with a grain of salt.
In terms of the checklist of what the CISO should do differently this week compared to 2 weeks ago, what are I mean, there's sort of the battening down the hatches part, but what's the pro advice that you're giving to these folks in terms of things that are a little bit different here, or it's business as usual, or maybe I should say unusual, and just carry on what you're doing already?
I mean, I think it's a little bit of both. I mean, I think it is business as usual. I mean, we should be doing the basic hygiene things in place, but we should also be aware of what's going on geopolitically and how that could impact us. So, and then the other thing is, here's an attack vector that was used, where the speculation is that it went in through Microsoft Intune, which they got into the dashboard at a high level and were able to wipe a number of devices. And so, again, looking at all of the threat surface that you have, this is a tool that's used for security. Many tools that are used for security are used by threat actors for bad. So, we need to be constantly thinking about what can happen with this tool in our environment, and just be aware that, no one's immune to attack. If they find a weakness, they're going to take advantage of it. And they certainly did in this case.
Interesting. Obviously, this is the flavor of the month right now in terms of talking about this. I'm sure there are other things going on with Health-ISAC, which, do not have the news exposure and quality, but are equally, if not more important. I'm just looking to get an update on some of the other key considerations that you're working on with the organization that again, might not be the big story on Action News right now.
So we just put out our annual report. So it talked about all the accomplishments that we reached in 2025. So that's pretty exciting. It's up on our website. What are
you most proud of?
Wow. We brought on a number of new members. I think that's something to be proud of. But we also did some disruptions. So we've partnered with Microsoft and other companies to take down 2 botnets in the last couple of months, actually 2 this year. Okay. And in this case, that actually led to arrests, which is the first time that's ever happened.
Wow, fantastic.
In all the work that we're doing. We started this with them when I was at FSISAC. Errol Weiss, who's our CSO, has been very involved as well. And, we saw the opportunity to do it again this year, and we've done it twice. We just did another one 2 weeks ago. So whatever we could do to disrupt, sometimes it's whack-a-mole, but, to make it harder for the threat actor to take advantage of companies and individuals, it really goes a long way. So I was just going to continue on that thread. We've held a number of summits. So we do 5 summits a year across the globe. This was the second time in 2025 that we did our CISO summit, and that was very successful. And we just, as you mentioned, I just got back from APAC, from our APAC summit, and everyone there was really engaged, really talking with each other about the threats that they face, the things that they're doing, the best practices and opportunities that they're taking advantage of within their environments. So that was really great. We, of course, have shared a zillion indicators with our community. We just, of course, I just did the joint product with the other ISACs. We did several of those. We did actually 3 of them last year, one on subsea cables, another one on some ransomware families. So it was, there's been some really great collaboration there at the National Council of ISACs level. We just did the one that you saw on our website, the joint advisory that we did with several other ISACs on the threat landscape right now as compared to Iran. And we just did the podcast. So a group of ISACs also did a podcast talking about how we're holding up our sectors and sharing information and making sure that everyone's aware of the threat that is out there and what they could do to mitigate against it. So, and then, the fact that, as I said before, that we're really carrying the flag in private sector. And as you can see, we're actually the ones being attacked as well. So
are you seeing, I saw your website where you had all the other ISACs across industries. Are you finding that there are any lessons learned from other industries that healthcare will be applying, or is healthcare right up there at the forefront of this because of the patient data aspect?
Oh, I think we're seeing that healthcare is definitely up there in the front with this incident that just happened. I like to say that health has become sexy, and the threat actors are going after it because it hurts. Yeah. And I think COVID, there's a number of reasons why that's the case. COVID definitely was a factor. When we had when you think about it, COVID brought the world to its knees, and people realized that health plays such a huge role in the well-being of our world, and it's also very vulnerable. And so it's a great way to make a statement. Interesting.
I'm sort of curious about the membership. If in fact your membership has changed. I mean, you stole a word that I use all the time related to governance, that governance has become sexy again. Yeah. It used to be the day that you missed the meeting, like if there's a governance meeting, I think I'm taking tomorrow off. Now you got to be there for the governance meeting because it's where it's all happening in a way, for good or for bad, with all the disputes that were going on. What are you seeing in terms of your membership base? Is that attracting a greater interest in security and healthcare than it has in the past because there are so many people involved in the governance side that weren't your typical security officers?
I would say yes. Of course, any incident always brings in people, and we've had a number of incidents over the last couple of years. We had obviously Change, we've had CrowdStrike, we've had a number of other big incidents and now this one where people who didn't realize that we existed or what we can bring to the table, realize it and then start joining. So that's definitely a factor. Yeah, there's been a lot of regulation or, encouragement, I'll say, is the nice way to say it, to get more boards and CEOs involved in the cyber discussion. And so I'm sure that's playing a factor as well, although I'm not sure how big of a factor that is. So it is interesting to see. I do believe that we have too much of a focus on compliance. And I go back to someone I knew from my finance days where he would say, if I hired 10 people, 9 were for compliance, 1 was for security. And I think so that, the focus is wrong. We should be looking at the security side versus the compliance side. I'm not saying compliance doesn't have its place, but I think we put too much emphasis and focus on it that is distracting from actual security measures that we need to put in place to make sure organizations are protected.
When you say compliance, are you talking about compliance within the enterprise or compliance on a policy and governmental level?
Both.
Or both. Okay. Both. There's a blinding lips to the obvious there. Okay. Yeah. So one of the things that we're seeing in compliance within the enterprise is the effect of what's now being called shadow AI and the uncontrollable use of one's own ChatGPT or Claude outside of the boundaries of the of the compliance people within the organization because I just don't like Pilot. I just don't like Gemini. I want to use my own. Is that a part of the work that you're seeing now? It's like a wildfire with people would only talk about this whole, ChatGPT thing, and now everybody's an expert.
Definitely. I mean, we had it with Shadow IT, and we still have Shadow IT.
Yeah.
So I think that it is definitely part of the discussions that are happening right now. Companies are obviously concerned about that. But I also think, especially in health, a lot of them are going in with a very measured approach and trying to design programs that they are able to control to some extent versus just being a wild, wild west within the organization with AI. And using all these, as you allude to, shadow AI types of programs. So I do think that I know in Health-ISAC, we are certainly taking a measured approach. We have some tools that we're using, but we're very cautious about how we're using it and what we're using and allowing staff to use. So I know a lot of health firms are doing the same thing.
Interesting. Again, just another word I'm picking up on, which is part of the work that we're doing, the insomnia aspect of it that you were gracious enough to put in the title, so I could use that as a key word. We're doing a lot of work right now on the Compassion IT programs that I do on CISO burnout and it being at an epidemic stage. I'm sure incidents like the Iranian thing aren't helping. What are you seeing out there in the field? First of all, about that, are you experiencing, not yourself personally, an increase in the burnout level, and are you finding that organizations are anywhere near prepared to do this when it took them so long to get their arms around physician burnout with the ambient technologies and things like that?
It's a thing. I think CISOs are definitely experiencing burnout. They're very stressed. It's a stressful job. And when you look, going back to the, governance regulation, a lot of pressure was being put at the CISO level instead of at the, CEO, level of the organization. I mean, when SolarWinds happened, it was the CISO that took the hit.
Right, big time.
And he was an acting CISO at the time at that. So it has really big repercussions. It's a very stressful position. It's high visibility, and when something goes wrong, it's definitely a bad day for a CISO that is seeing their company's name plastered all over the news and not in a good way.
Yeah, it's interesting because we talk so much about pajama time with physicians, and there should be a separate word besides pajama time for CISOs. But even though it's the same issue, they're not there entering patient records at 4:00 in the morning. But at the same time, it's even more complicated than taking a visit, a telemedicine visit, and transcribing it using ambient. So it's going to be an interesting time. So we're focusing on that. I really would like to get an international perspective on that, and some of the other things. Having just come back from Asia, I know it's a great venue that people go there. But I'm wondering, first of all, did you find any geographic or cross-cultural differences, or do you, as the professor of cross-cultural communications at a university here in Boston? I'm always curious about that. Or is it pretty much the same? And I'm just curious how people are viewing cybersecurity in general around the globe, because we're so connected in so many ways that you're here in Boston, but you're international just by the fact that you're connected. So what are you seeing that might be an international nuance that's popped up, or maybe I'm overestimating that as well?
I think in anything there are nuances, definitely. I think also, though, we see the same problems. And one of the things that I hear from people all the time is, wow, I thought I was the only one. I didn't realize everyone else is facing the same thing I'm facing. So that's definitely a call that's out there, is that many of us have the same problems. So that's why it's so important to share with each other and talk about these things. But there are also geopolitical nuances. One of the things that's very interesting is, and let me go backwards a little bit. When I was with FS-ISAC, so the Financial Services ISAC, we had a workshop that we did in Singapore. And at the time, the Singtel, Singapore Telephone, had done a deal with Iran. And if you know anything about the banks in the United States and
Mhm.
Iran, they're not very friendly.
Not
So
connected.
we
Yeah.
had those huge attacks back in 2012, 2013, and the banks the financial sector does not look on Iran with fond memories. And when we were in the workshop, there was a question and there was discussion around this partnership between Singtel and Iran, and they didn't see it as a threat. And that was very eye-opening to me because different countries look at different countries differently,
Sure.
if that makes sense.
It
So,
makes total sense. Yeah.
yeah. So, we may come in with one lens as the United States, as someone who lives in the United States, and somebody who lives in Singapore will look at it differently because maybe the partnership is different, the threat is different. And so the reason I bring this up is because when we were over there, China was one of the topics, and many of the organizations have operations in China. And having to deal with that and having to, they asked me a question like, why aren't you doing a workshop in China? And I said, well, I'm not going to do a workshop in China, but they live in China. So, they come at it with a different perspective than we do when we live in different areas of the globe.
Absolutely.
So
You make a great point. Because when I teach these classes, I try to separate people from making American comparisons to the Chinese. So what if you were in Bulgaria and working with a Chinese person? So completely different complexion. One of the things I think where there are cultural differences, which is part of the work that you do, is in terms of the breach communications response aspects of it, because people communicate differently around the world about bad things that happen. So I had the opportunity to be part of the IBM cyber range in Cambridge, Massachusetts here, where it's a simulation where you become a PR director for a day and deal with what seems to be a real life breach scenario, and they've got the CNN studio there, they've got the stock market ticker there. So anything you say something bad, the stock market starts going down. You say something great,
wow.
start going up. But I thought the interesting thing is considering the way that people communicate differently across cultures, that somebody in Asian cultures where they are in shame cultures, they're fearful of shame, that saying something that would be shameful about their company related to a breach would be more difficult. So I think those intersecting points of, I have my Tokyo office on this call, and here's our breach response strategy, and you have to go out there and say something that might be shameful.
Well, yeah, that definitely is a consideration. And, it's interesting because a lot of Asian cultures are very hesitant to speak out in public as well.
Exactly.
So that was something we experienced in Singapore. I was one of the first times that I ever saw this, and this was many, many moons ago, but they had an app and now of course it's common, but they had an app where you could ask questions because they didn't want to answer it or ask the question in the audience during the presentation. So that was interesting. But going back to your question, I think different countries have different regulations. And we were even talking about, for example, India, who has probably one of the tightest regulations in the world. I think you have mere hours to report an incident, whatever that incident may be. And it's not, that's another issue, is like what's defined as an incident. So there's different rules, just like we have here in the United States with the different states. We have to report different ways with different federal agencies. That happens in Asia as well. It's just actually more complicated because you're doing it in different languages. You're doing it with different reporting times and different reporting agencies within all the different countries you may operate in. So it's complicated.
It's gonna be interesting as it metastasizes, and the fact that what we learned from CrowdStrike obviously was that these things are embedding themselves in things that we didn't even know were connected. So are you seeing more of your constituents doing different kinds of audits of where the tentacles of these things are that we had to do? I remember, I think it was CrowdStrike or Change that part of our operation could only do handwritten checks because it invaded the check rating, the electronic check rating capabilities, when you didn't even think that was something that was part of the system that you had now. How do you handle that metastasizing on a global scale?
It's hard, and probably third-party risk management is one of the most prevalent concerns for security. And it's not even third party, it's fourth, fifth, sixth party.
Right.
Because you don't even know who your third parties are using and how that could impact you. So, and we're seeing a number of breaches happen where a third, fourth, fifth party is breached, and then that impacts the organization. So like SalesLoft last year was a huge one, and impacted hundreds of organizations with that vulnerability and that breach. So it's a very complicated, thorny issue. And I think that's probably one of the things that keeps CISOs up at night is managing the third party risk. So yeah, definitely. One of the things that we're doing that's kind of exciting in the health sector, our sister organization, the Sector Coordinating Council, the Cyber Working Group, part of it, has worked on a project they call SMART, and that's where they're mapping out the single points of failure within the health ecosystem, and then trying to align and figure out how best to mitigate against that from a sector-wide level. So that's been a very worthwhile project, and one that I've really advocated for a long time. And so it's exciting to see that come to fruition. And we do have single points of failure within the sector that we need to be mindful of and be sure to be situationally aware on, and also look at mitigating and controlling factors around it.
Are there any new single points of failure that have come up that we wouldn't have recognized 2 years ago?
I'm not sure that there are at this point in time. There may be, but none that really came out in that project. I think it's stuff that's been around for quite a while.
What's an example of a major single point of failure?
Definitely around the imaging systems.
Okay.
And when we've seen ransomware attacks, one of the reasons that hospitals can't conduct operations is due to imaging. So there's definitely a very limited set of companies that do some of the imaging, archiving, and picturing, and that's definitely a factor.
Great closing remarks. I just want to thank you again, and I'm hoping we'll see you soon, but not about something as drastic as what's happening this month. So really appreciate it.
Yeah, thank you. Thanks for having me.
Thank you for joining us today in the shadows for this episode of Health Stealth Radio with Frank Cutitta. If you like the program, please be sure to share your comments on our social media sites, or feel free to contact us with suggestions for new and stealthy show themes. We look forward to welcoming you again for our next broadcast. In the meantime, stay safe out there.